So this is the extension of the previous video in which I have made the correct combinations of the nerve, muscle and the function. So starting from hip flexion, the muscle involved is iliopsoas. It is also held by rectus femoris and the main nerve supply is femoral nerve. Next, the hip extension. The muscle involved is mainly gluteus maximus. Its nerve supply is inferior gluteal nerve. However, it is also held by hamstrings that is supplied by sciatic nerve. Next, we have external rotation of hip, and the muscle that is involved is again gluteus maximus, and the nerve supply is obviously inferior gluteal nerve, and it is also held by quadratus femoris, whose nerve supply is femoral nerve. Next is hip internal rotation. Hip internal rotation and hip abduction, they are both caused by gluteus medius and minimus, and the nerve supply of these muscle is superior gluteal nerve. Talking about hip abduction, so the hip abduction, the muscles involved are adductor longus, brevis and magnus, and the nerve is obturator nerve. The knee extension, the muscles involved are quadriceps, as I already told you, and the nerve supply is femoral nerve. Knee flexion, muscles involved are hamstrings and the nerve supply is sciatic nerve. Likewise, for ankle inversion, the muscles are tibialis anterior and tibialis posterior, and you guys will know that tibialis posterior is supplied by tibial nerve and tibialis anterior is supplied by deep peroneal nerve. Next is ankle eversion. The muscles are peroneus longus, brevis and tertius, and supply is peroneal nerve. Dorsiflexion of the ankle joint, we have muscles tibialis anterior, extensor humerus longus, extensor digitorum longus and peroneus tertius, and the nerve supply is deep peroneal nerve. Plantar flexion, muscles involved are gastrocnemius, soleus, plantaris, tibialis posterior, flexus, and we have peroneus longus and peroneus brevis also. So the peroneus longus and peroneus brevis are supplied by superficial peroneal nerve. The other are supplied by tibial nerve. Here I would like to revise that superficial peroneal nerve supplies peroneus longus and peroneus brevis. However, peroneus tertius is supplied by deep peroneal nerve. So this is how we can revise the muscles, their nerve supply and their action. You can make this also for the upper limb and also for other regions also. And the other thing is you can make the pairs and you can just bind them together, and whenever you want to play you can just shake the box or mix them and then play the game. Hopefully you will enjoy that. Bye.